Hello, my name's Tyler. So I was in a bad car accident a few years ago when I was in my second year of an agricultural management diploma. I was living in residence on campus and working part time at a local restaurant in the evenings to pay some of my tuition. My schedule was very busy, but I focused on my studies and managed my time well. Every second weekend, I traveled home to help my dad on the family farm, spend time with my family, and enjoy some home cooked meals. I helped with chores, and my mom made meals for me to take back to school. This was so helpful and gave me extra time to study between classes and work. I have always been a healthy person who eats well and exercises regularly. At the time of my accident, I was 21 years old with no known medical conditions or allergies and no past surgeries. I am a non smoker who drinks socially with my friends, but never excessively and never to cope with stress. On the day of the accident, I was heading home. It was around 7 p.m. and I was feeling pretty tired. I remember feeling pain everywhere. I was hot. There was pressure on my chest. My hands and face were wet, and my body was in a sideways position in the car. There were people all around me and lots of noises like sirens, loud talking, even yelling. So I don't remember much about the accident, but recall I had a hard time hearing, and voices would cut in and out, making it hard to understand what was going on. Some of the people who helped me told me later that I was slipping in and out of consciousness.
Hi, my name is Joan and I am an advanced care paramedic. We got a call from 911 and went to the scene where we saw a single vehicle accident involving a male in his early 20s. We first checked his ABCs, his airway, breathing, and circulation. We then started an IV and made sure to immobilize him by putting on a cervical collar. Finally, we did a rapid trauma survey and extricated him. Once a patient is in the back of an ambulance, our primary role is to make sure the patient is in stable condition. If the patient is not in stable condition, we do our best to treat them and we take them to the hospital as fast as possible for specific care. For Tyler, we assessed his vital signs: his blood pressure, respiration, pulse, blood, glucose level, pupils, and oxygen and carbon dioxide levels. We then started an intravenous line in case there was any internal bleeding or if we needed to give medication. EMS works collaboratively with other first responders such as police and the fire department. Once Tyler was stabilized, we transported him to the nearest hospital. We notified the hospital prior to his arrival to make sure the appropriate staff would be present and have a room prepared in the emergency department. In some cases, a primary care paramedic and an advanced care paramedic will help. In rare cases, an emergency medical responder will help. This will depend on where we are working, in an ambulance, hospital, community, or job site.
Hi, I'm Sam, a registered nurse, or RN from the emergency department, to prepare the trauma team before we see a patient in a life-threatening state. The paramedics call us on the patch phone. In Tyler's case, we received a call reporting a single-vehicle motor vehicle collision involving a male patient who was C-collared and extricated on scene. The medics told us that he had a decreased level of consciousness. Tyler arrived at the hospital emergency department with the paramedics where they entered triage. This is where we do a preliminary assessment of the patient's casualties to determine urgency of care. Tyler was in and out of consciousness, so we used his driver's license to confirm identification and enter the information into the computer system. The paramedics were then directed to take Tyler to the trauma room. When Tyler reached the trauma room with the first responders, they shared information about the accident site and discussed Tyler's condition with a trauma nurse, doctor, and trauma team. The trauma team quickly communicated which roles each member would take. As the RN, I was responsible for working directly with the patient. We removed his clothing, checked the IV site, performed blood work, put monitors on the patient, completed a quick head-to-toe assessment, and inserted a Foley catheter for urinary output to check for abdominal trauma. We shared our findings with the team as we assessed the situation. The charge nurse documented all the important information in the patient chart.
Hi, I'm Randall, and I'm a registered respiratory therapist, or RRT. As an RRT, I sometimes join the trauma team to assess patients who are experiencing respiratory distress and low blood oxygen. I was called to the ER just before Tyler arrived. When I got there, I checked his oxygen levels and performed a detailed respiratory assessment, which includes obtaining vital signs, listening to breathing, drawing arterial blood for acid-base analysis, and performing oxygen therapy to correct for low blood, oxygen, or ineffective breathing. While I performed these assessments, other members of the team assessed Tyler to decide what we should do next. I shared my thoughts on the situation and presented my findings with the team lead and physician. We continued to evaluate the patient and keep each other updated as we observed any changes to his condition. We also helped each other when necessary. RRTs and RNs share a great deal of responsibility. Our shared work includes patient assessment, oxygen therapy, and placing intravenous lines. Working together in this way helps us operate as a team, providing complete care for the patient.
Hello, my name is Rohan, and I am a medical office assistant. My job is to manage the operation of the hospital. My primary roles are to ensure safe and efficient operations and oversee the administrative functions to make sure patients receive the best possible help. I also facilitate communication between healthcare providers and staff and liaise with insurance providers to ensure optimal care. Normally, I would register a patient in Tyler's condition into the hospital system after the triage nurse performs an assessment. However, since he came in on a stretcher, I registered him at the bedside using the ID that was in his wallet. As the team made stat orders, I received and processed the order as urgent and notified everyone who would carry out the necessary tasks. The unit clerk received the urgent or stat request to check oxygen levels and track down the RRT. The unit clerk then contacted a porter to send the collected samples to the lab.
As you can see, I interacted with many different health professions along my journey. It is great to see how these professions work together to ensure I get the best care possible.